On this edition of Fulton at Work, Fulton takes major steps in the effort to combat HIV and AIDS in Fulton County. We'll tell you how. Plus, we'll talk to the Executive Director of Georgia Equality about what they're doing to help young people with HIV and AIDS. I'm Darryl Carver. All this and more on Fulton at Work. Please stay with us. Welcome to our show. I'm Darryl Carver. After months of hard work by a team of medical professionals, Fulton County officials announced their strategy to end AIDS in Fulton County. The news came on World AIDS Day 2015 and was met with great applause and great hope. FGTV's Lynn Vaughn starts us off.
Fulton kicked off its World AIDS Day commemoration in Assembly Hall with details on a new plan. It was put forth by the HIV/AIDS Task Force established by the Board of Commissioners a year ago. Entitled Building the Strategy to End AIDS in Fulton County, the plan calls for increased education, prevention strategies, support, and awareness. Those goals are in line with steps Fulton Health Services has already initiated to end HIV in the county.
I invite you to join us in continuing this fight. We can do this. If San Francisco is doing it, we can do it as well.
The full board supported the creation of the task force as put forth by Commissioner Joan Garner and Chairman John Eves. Phase 1 of the task force's work has been to assess needs and to target services toward them. It wants to eliminate perinatal HIV transmission, link diagnosed persons to care within 3 days, and increase the number of people who know their HIV status. The task force estimates 2,800 people in Fulton don't know they are infected.
Our next part will be to go to the community to get their input on how do we get to those goals? What is it that they want to see us do, and how can they make a difference in changing people's lives?
The day continued with a partnership with Georgia Equality. The group has a specific interest with youth who have HIV. Young people under 35 are hit disproportionately harder, so the county is working with 11 youth HIV policy advisors.
What's great about this program is that it comes from young people who are personally affected with HIV, so they know what it means to live with HIV, and honestly, you need people living with HIV to help you stop HIV.
The HIV task force will work toward the new goals and review phase 1 of the strategy plan in May 2016. Reporting for FGTV, I'm Lynn Vaughn.
Now, Jeff Cheek is the director of Fulton's Ryan White program and also a member of the Fulton County Task Force on HIV and AIDS. And first of all, Jeff, thank you for being here.
Thank you, Darryl. It's great to be here with you today.
Now, this all was big news on World AIDS Day, and I'm sure great news for those who work on behalf of folks with HIV and AIDS.
I think it was very exciting. Fulton County has been committed to HIV services for a number of years, and we've been very supportive of having community input. We have a prevention planning group, and we have a Ryan White care group that have been looking for years at how can we best provide services. But the difference is with the HIV/AIDS strategy, we're saying how can we end HIV in Fulton County, and how can we reach that day where we no longer have to provide services to people living with HIV.
Now, you've had to look at a lot of these statistics, and frankly, a lot of them are staggering. Mm-hmm. Where do we stand right now in terms of other cities in the United States, other counties in the United States?
Sure. Well, when you're looking at the number of cases as a whole, we are number eighth among all cities in the United States. When you're looking at new cases of HIV, we're number 5. So we're doing a better job of getting people in care, keeping them in care, but we're not doing as good of a job of keeping people from getting HIV disease. One of the other things that we like to point out is that in Georgia, 1 out of every 3 cases of AIDS lives in Fulton County, and 1 out of every 4 cases of HIV lives in Fulton County. So the epidemic is great here among our community.
And I was going to say, at that event, one of the things we heard over and over again was the use of the term epidemic, and sure. A lot of the health professionals describing it as a true public health epidemic. Mm-hmm. Why was a different strategy so desperately needed as a result of that?
Sure. Well, when you use the word epidemic, typically you look at the definition that's supplied by the World Health Organization, and they say that concentrated epidemic is when you've got about 5% of your population, of a targeted population, that has HIV. But you have a general epidemic when at least 1% of your population as a whole is affected by HIV disease. Emory University did a study a couple of years ago that saw that in Atlanta, in Fulton County, the percentage is about 1.34%. So we are right there with many developing nations in the number of people that are living with HIV disease among our population as a whole.
Now, in some of the talk about what the strategy entails, kind of go into a little bit about what exactly is being called for here.
Sure. Well, what we're calling for is ensuring that we are letting people know about HIV disease, getting them in to get tested, and if they find out that they're positive, getting them into care and treatment. What we found over the past years is that if we get you started on medications, not only is your health improved, but there's more than a 95% chance that you won't be able to spread the disease to other people. So we're working to make sure that people get tested, get into care, stay in care, and get on medications. We're also looking at prevention in a whole different way. Science has recently shown that if individuals take medications called PrEP, which is pre-exposure prophylaxis, they can actually protect themselves from getting HIV disease. So part of the hope that we have as a community is that we could really stop the spread of this disease. And I think it's also important that this plan is aspirational, that as you heard Lynn talk about earlier, we're saying we want to get people into care within 3 days. Well, that's pretty impressive because the national standards have been that you get folk into care within 90 days. And they're saying, well, now maybe let's get folk into care within 30 days. And what we've said is we want to have the audacity to dare to say we're going to do that even better. And we in Fulton County are going to get people in care even quicker.
You want to get this strategy to the community. How do you plan on doing this, and what do you hope to get from that community input?
Right. Well, we've gone through the process of setting the big goals that Lynn talked about earlier. What we now need to do is sort of develop the roadmap for how we're going to get there. If we say we're going to get people into care within 3 days, what does that mean? What does that mean for our agencies that provide services? What does that mean for people that provide testing? What does that mean for the community as a whole? So what we've done is we're having input from our different planning bodies, such as the Ryan White Planning Council and the Jurisdictional Prevention Planning Group. But even more importantly, we're going to the community through a series of listening sessions. We've had a series of those throughout previous months. We've got 2 more coming up in December and a series in January as well, where we're inviting people to come out and say, what do we need to do about prevention and what do we need to do about care?
I think a lot of people don't know about the efforts of the Ryan White office. If you can kind of go into what exactly your team does there.
Sure. Well, we have a very exciting job, and that is to work with our community to make sure that they've got the funds necessary to provide services to support people in care and treatment. But in addition to providing medical care, which is overwhelmingly important, we also know that we've got to address those other challenges that people face. So we also fund mental health services, substance abuse services, transportation so that people can get to care, meals so that people are able to stay healthy and take their medications. So we're looking at a whole comprehensive series of services. And what our role is to do is to find out from the community what the needs are, how they would like to see that money spent, and then pick agencies that can best provide those services. For example, last year we provided services to more than 14,000 people, and 12,500 of those got primary care through our services.
Now, just your final thoughts on the issues with HIV and AIDS here in Fulton County, and really what sets Fulton County apart in terms of the demographic that you deal with people suffering from HIV and AIDS, as opposed to a lot of other cities.
Sure. I think what people need to know is that in Fulton County and in the state of Georgia, HIV is among the top 5 causes of death for all African American men between the ages of 25 and 54. When you're looking at the age group 35 to 44, it is the #1 killer of African American men in Fulton County. So we've had a very clear wake-up call, and we know that the challenges are there. But I think we as a community are ready to stand up and face those challenges and to demonstrate to other communities that we are ready and willing to fight our epidemic and to end the spread of HIV disease.
It's a huge task you have ahead of you. Jeff Cheek, the director of Ryan White, thank you for joining us.
Thank you. It was a pleasure.
When we come back, we will have the executive director of Georgia Equality. Please stay with us. Welcome back. Earlier in the program, we mentioned Fulton's partnership with Georgia Equality in response to high and increasing HIV rates among youth in Atlanta. Georgia Equality has launched the Youth HIV Policy Advisors Program. The program matches selected elected officials with youth advocates who then serve as their special advisors on issues related to youth and HIV. Jeff Graham is the director of Georgia Equality, and welcome to our show.
Thank you, Darryl. It's a pleasure to be here today.
First, before we talk more about the Youth HIV Policy Advisor Program, please tell everyone about your organization, Georgia Equality.
Sure. So Georgia Equality, we're actually a state-based organization. So we do our work throughout the entire state of Georgia. Our offices are here in Metro Atlanta. And our mission is actually to advance fairness, safety, and opportunity for lesbian, gay, bisexual, and transgender communities and our allies throughout the entire state of Georgia. And while we work primarily on LGBT rights and making sure that policies and public education is there to support LGBT people and our families, we know that because the HIV crisis has had a disproportionate impact on the LGBT community, that it's an important issue for us to take a look at. But I want to make sure that everybody understands that just because we're an LGBT organization, when we work on the issue of HIV and AIDS in particular, the work that we do is for all people living with HIV and AIDS and all people at risk for HIV and AIDS, not just the LGBT community. That's where the allies part of our mission comes in.
So your group deals with all issues that impact the LGBT community, from legislation to healthcare, correct?
That is correct. We've got a real broad policy agenda. We work a lot on non-discrimination. We work a lot on safe schools. We also work on health policy. And that's where the HIV work comes in. We work with local governments, a lot of work with the city of Atlanta, and we've done a tremendous amount of work with Fulton County, but we also do a lot of work at the state legislature. Some of the work that I'm proudest of in the partnership with Fulton County was this past summer around the Supreme Court decision around marriage. We worked very closely with Chairman Eves. We worked very closely with the courts. We worked very closely with a number of departments in Fulton County to make sure that on that very special and historic day, Fulton County was prepared. And I am proud to say that Fulton County was the first county, not just in Georgia, but in all 13 states that had yet to issue marriage licenses. Fulton County was first. It was a great day for everyone.
That was a really, really big day here in Fulton County. What went into the planning to it?
Sure. Well, from the moment that we knew that the Supreme Court took this case up, we were anticipating that there was going to be a ruling that we hoped would go our way. There are, of course, no guarantees when anything goes to any court, especially the U.S. Supreme Court. But we knew that regardless of what their decision was going to be that day, it was going to be a historic day, and there was going to be a lot of interest in that. And so we set up meetings early on with Chairman Eves. Then we got several members of the courts involved with that as well, so that we could just plot out what were going to be the challenges, what were going to be the questions. From our perspective, we knew that there would be a number of couples that would want to immediately come down, get marriage licenses, and get married that day. So there was a lot of logistics that we needed to plan out. And where our teams worked very well together is that, believe it or not, we had no idea what day this was going to happen. So we planned for an event that ultimately included hundreds of people, but we had to do that for a day that we would not know that day was happening until the moment it happened. So at 10 o'clock on June 26th, when the Supreme Court said that that was the day that they were issuing the decision, that's when we were able to pull the trigger on our plans. It was really a wonderful textbook case of an organization being able to work very closely with Fulton County to make something, an event that everyone could be proud of.
And let's talk about the organization's push to develop this Youth HIV Policy Advisor Program. Why did you determine there was a need?
Well, about a year and a half ago, there was a study that was released by Emory University that indicated that specifically amongst young Black, gay, and bisexual men between the ages of 18 and 24, the HIV infection rates were going up. And the HIV infection rates were going up to such a degree that it was projected that by the age of 30, 60% of young Black, gay, and bisexual men here in Metro Atlanta would be HIV positive. That's just outrageous. It makes it one of the highest HIV infection rates amongst a specific population anywhere on the planet. And so we knew that, first of all, people needed to be aware of this challenge. So last year, we brought a lot of stakeholders together and we released this information on World AIDS Day in 2014. And that day was when, as you've already heard, Chairman Eves and Commissioner Garner, they were part of the folks that were in the audience that day. They heard that information. They immediately took it back a couple of days later to the entire Fulton County Commission, and I am so pleased that the entire Fulton County Commission voted to establish the Fulton County HIV/AIDS Task Force. So phase one of our work to draw attention to the youth HIV epidemic had happened a year ago. Then, as you've heard, it's important that we actually have the voices of youth involved in this process because they really understand in ways that the rest of us don't what the challenges of youth living with HIV are. And frankly, when it comes to not just services but also prevention, young people who have become infected with HIV, they're the best folks to help guide us on what are the policies that need to change, what are the systems that need to change, where do we need to do more education, where do we need to fill in service gaps. So we worked with a group, it started off about 20 young people living with HIV over the summer, and that dwindled down to about 14 by October. They went through 41 hours of training, so they were trained on the demographics of the epidemic, trained on how the current system of care works, trained on some of the best practices around HIV prevention, but also trained on how to set a policy agenda together. How do you work with government to actually make the change that people want to see happen? And so they went through this summer worth of training, and then in October, we brought them together with elected officials from the city of Atlanta, from Fulton County, from local school boards, and from the state of Georgia through the legislature. And then during October and November, they met with their elected officials and learned a little bit more from the inside on how government works. And using what they learned, they put together a policy agenda, some recommendations for change here in Fulton County and throughout the Metro Atlanta area that we feel will really make a big difference in our ultimate goal, which is to stop HIV infections, especially amongst this most vulnerable population of young people in Fulton County.
And what does the group feel is its biggest obstacle or barrier when it comes to the youth population living with HIV and AIDS?
Well, certainly one of the biggest challenges in terms of prevention is to make sure that we have good, comprehensive, evidence-based sex ed in our public schools, so that youth actually have the information on how to protect themselves against HIV infection and, frankly, to help protect themselves against sexually transmitted infections or pregnancy as well, but also how to make responsible choices. An abstinence-only curriculum, we feel, only gives one part of the argument to our young people. So it's important that we provide them with tools and skills and knowledge that is very comprehensive, that includes the role of abstinence and how to actually choose abstinence, but also how to protect yourself if you will be sexually active. For young people who are HIV positive, the biggest challenge they have is understanding how to access the services that we have here in Fulton County. As you've already heard from my colleague Jeff Cheek, we've got a system of care that we should be very, very proud of here in Fulton County. But if people are having trouble accessing that system of care, then it's failing them. And we know through some of the excellent data that we're beginning to get these days that young people are especially vulnerable. I've heard far too many stories of people in their 20s infected with HIV, but frankly, still dying of an AIDS diagnosis, of AIDS-related complications in their young 20s. That should not be happening at all anymore. And so as a community, we've all got to pull together to take care of our young people. And listening to them and the challenges that they, as young people, have had, even knowing how to begin to access the care they need, the support services they need, and the medications and understanding that they need to, frankly, save their lives is very troubling. And so, again, I'm very pleased that leadership at all levels of Fulton County is taking this issue very, very seriously. And I look forward to what we'll be able to do in the months to come in terms of changing this situation.
And finally, Jeff, how can people get in touch with Georgia Equality?
You can find information for us on our website, and that is georgiaequality.org. And Georgia is all spelled out. It's georgiaequality.org. You can find out information on our work to support the LGBT community, but you can actually see the full youth HIV policy agenda that is also there. In addition to other health resources, including how to sign up for insurance under the Affordable Care Act, and how to find out that your rights are protected as an LGBT person if you feel that you've faced discrimination. So thanks so much for having me on the show today.
Really great work by the youth advisors and Georgia Equality. Jeff Graham, thank you so much for your time.
Thank you.
And we'll be right back. Thank you so much for joining us for Fulton at Work, and we offer a very special thanks to our guests today. Now, we want to connect with you online. Check us out on Twitter, Facebook, and Instagram. I'm Darryl Carver, and we'll see you next time.